So we were talking about Niam's postural tendency. Now we said from the side view that his pelvis is forward and his cage is back this way. So we talked about that the correction with a therapeutic exercise is we're pushing the pelvis back and we're pressing the cage forward. And when you move the cage like this, it takes the stress off the low back and decreases the low back pain. But because the pattern's been like this for so long, we're going to need some extra help. So we're going to create an in-office and a home traction setup to help Niam go back into a corrected posture. So this is his present in-office traction. So we've got his feet elevated and his pelvis is back. So that's creating this correction of pelvis back. But the most important part is that from a very specific vertebra, his L1 vertebra, we've got this apparatus set up that this is pulling here. So this cable system is pulling, creating tension against that vertebra, and we leave it there for 15 minutes, and it helps, the term is remodel the posture. Now, we talked before about that ligaments will only change shape if you can hold them in a corrected position for a minimum of 10 minutes. So we do our traction in office at 15, and we use the home traction units that kind of mimic this correction for 20 minutes. We can be way more specific in here because I have all these different angles that I can create to go exactly opposite a pattern. Now, how you doing there on the traction today? Good, good. So when you first started with us, what were you feeling in terms of the low back?
You could feel a little strain because it's obviously, it feels like it's pulling, but when you do it now, I think that was me more fighting against letting what's happening happen. So now it's, you just let it happen, you let your hips sink back, and then you feel the cage pushing forward, and then the lower back feels like it's getting a curve.
Super. Getting a curve, that's super important. And how's your low back feeling like day to day?
Yeah, much better, much better. I noticed between the lower back is feeling much better, and then the leg, I used to have some leg pain where hamstrings would get tight or calves, and the more I do the traction, the less I feel the leg pain. You know, it pops in here and there, but usually it's because I did something. But before,
because you're still athletic, because you're still doing your judo. You're still trying to do stuff. So if you had to guess, where do you think the original injuries were that created the problem? You think it came from American football? You think it came from?
It could have come from football, but it may have also come from because I was also doing grappling at that point and kickboxing. So I may have turned with torque without knowing which way I was turning. So giving myself a slight injury just added on to it over year.
Yeah, years over year, yeah. But this is an awesome correction. Thanks so much, yeah. This is how we're gonna correct it.